Hello, everyone. My name is Crystal Grant, and I will be doing my specialty modality PowerPoint over the condition diverticulitis for radiology 2233. What is diverticulitis? Diverticulitis is a complication of diverticular disease of the colon. It's usually going to look like small, bulging pockets in the lower intestines along the lining of the sigmoid colon. The presence of diverticula is known as diverticulosis. However, when one or more of the pouches become inflamed and infected, the condition becomes diverticulitis. Signs and symptoms of diverticulitis are severe abdominal pain, commonly in the left lower abdomen, nausea, vomiting, fever, bloating, and constipation. Not often, but diarrhea can occur as well. Now, these symptoms usually last for several days consistently. Causes and risk factors. Although the cause of diverticular disease is unknown, there are many risk factors that play a part in causing the flare-up to happen, which is known as diverticulitis. Some of those causes are trapped stool, bacteria in our gut that forms called microbiome that helps with digestion, chronic body inflammation, genes. Um, it's hereditary, diverticulitis is. Immune system problems such as certain types of autoimmune disease, for an example, Crohn's disease. And then when it comes to risk factors, you have to take into consideration some lifestyle risks such as obesity, lack of exercise, NSAIDs, which is non-steroidal anti-inflammatory drugs like Aleve and naproxen, and steroids, smoking in age. This common condition is something that usually happens in people who are 60 years and older. Now, don't get me wrong, it can happen to anyone of any age, but it's commonly in people who are 60 years or older. In the role of imaging, there are a few different modalities that helps when it comes to diagnosing diverticulitis and confirming that the problem is actually diverticulitis. One thing I do want to mention first is that a plain x-ray usually does not indicate the signs of diverticulitis. So the preferred method is CT, computed tomography. You usually will perform a abdomen with pelvis exam to help confirm the diagnosis and rule out any abnormalities of the pelvic area and any other diseases that may be causing these complications. But as we know, there are some limitations to using CT, such as high radiation dosage and cost. Now, before CT became popular with scanning, barium enemas and fluoroscopy was one of the preferred methods to diagnose diverticulitis when it was suspected. But like any other modality, it has its cons. With using a barium enema, with fluoroscopy, there is high radiation dose as well. And also, if a patient is experiencing a flare up from diverticulitis, it could definitely be dangerous to use the enema tip because it could perforate the bowels and cause a more serious condition, causing the barium to leak into the abdominal cavity. Just to throw in a little more information here, after some research, I shockingly found that ultrasound is rapidly growing to use for diagnosing of diverticulitis. And that the US shows 85% accurate rate when using ultrasound. Um, Before they started using ultrasound, according to the authors of the article that I read, there was a lack of experience with abdominal ultrasonography because the techs were not familiar with diagnosing diverticulitis using ultrasound. So I think it's pretty cool that this is something that is rapidly growing because we know ultrasound is doesn't use radiation, so it could be a lot more beneficial to the patients when it comes to receiving a radiation dose. On the next few slides, I will discuss what diverticulus looks like and give an example of each modality that I have talked about, okay? So this slide gives you a general idea of what diverticulitis looks like. The picture to your far left is going to show you the large intestines. The larger orange outpouches that you see are examples of what the diverticula looks like inflamed. To the right in the circle, it's going to show you what the inside of your sigmoid colon looks like when the diverticula is inflamed. In the lumens, you see bleeding, you see inflammation. So I'm sure that can be a pretty painful thing. Then the picture to the right kind of gives you more of a realistic view. You see diverticulosis where it has the lumens on the inside of the intestines. That's where you're going to see the outpouching on the outside. And then with diverticulitis, if you will pay attention to the yellow circle inside of the lumen, that is inflammation, that's infection, that's what's causing the pain, the bloating, all of the discomfort that is experienced in the sigmoid colon when you are having a flare up with diverticulitis. This is my CT modality that I will be using to show evidence of diverticulitis. This exam was actually performed while on my CT rotation. The patient came in with pain in the lower abdomen and constipation for a week. The doctor ordered a CT abdomen pelvis without contrast. So what you see are the results. The pictures of the CT are sagittal views. On the first picture, you see the patient's intestines through the transverse colon, has the rigid, thickened walls of the intestines showing signs of diverticula. Um, in the black area where there's air and gas filled in, I'm pretty sure that has a lot to do with the pain that he's experiencing, the constipation. And then the second picture, where you see the arrow pointing, shows a large outpouching, which is evidence of the diverticulitis. So the black circle indicates that there is, gas inside of the lumen. But if you look right along that, there is white signs along the sides of that, which indicates inflammation. Once we sent the images in to the radiologist and he read the images, the report did come back that the patient had cholelititis with severe acute diverticulitis in the sigmoid colon. This slide has a picture of evidence of diverticulitis with a fluoroscopy method using single contrast barium enema. This image is a RAO, a right anterior oblique, single contrast barium enema. The blue arrow to the left is pointing to the outpouching in the hepatic flexure of the large intestines. And then if you will look over to the right side of the picture, you will see the sawtooth-like appearance of the sigmoid colon, which is also one of the signs of diverticulitis. And I included a image of sonography or ultrasound that took place to diagnose diverticulitis. On this particular ultrasound, the transducer was placed on the area of the patient where they were complaining of pain. So the larger oval circle that you're going to see um, is indication of signs of an inflamed colon. You've got the dark outline around the lumen of the colon. And just below that, you will see the diverticula that is outpouching, which is the common sign of inflammation of the diverticulitis. You see where it says diverticulum. The research did indicate that that is diverticulitis because of the gray area inside that shows it to be inflamed, the thickened colon wall. So those are evidence on an ultrasound. I think it's pretty cool to be able to actually see what it looks like on an ultrasound because before researching, I didn't know that ultrasound could be one of the modalities used to diagnose diverticulitis. So according to the Mayo Clinic, care and treatment of diverticulitis depends on the severity of the illness. Um, Uncomplicated diverticulitis may be able to be taken care of at home with some oral antibiotics and a change to a liquid diet for several days until your bowels are healed, and then gradually add solid foods back. Now, if it's complicated, it may cause for a stay in the hospital. You have to have IV antibiotics, and if any abscess were formed, an abdominal tube might be inserted to drain those abscesses. More severe cases, such as abscess, fistulas, and obstruction, or perforated bowel, may require surgery repair. There are two different types of surgery that I will discuss. So there's a primary bowel resection where the surgeon removes the diseased segments of your intestines and then reconnects it to the healthy segments. And then you have a bowel resection with a colostomy. So again, if you have so much inflammation that's not possible to rejoin your colon and rectum, the surgeon will perform a colostomy along with the resectioning and leave an opening in your abdominal wall to connect the healthy part of your colon with a bag for your bowel to go into. Now, one of the things about this is that once the inflammation has eased, the colostomy may be reversed and bowels reconnected back together. So for care and prognosis, the prognosis in patients with diverticulitis depends on the severity of the illness, the presence of the complications, and the presence of any coexisting medical problems. Approximately 85% of people with uncomplicated diverticulitis will respond to medical treatment, while approximately 15% of patients will need an operation. Now, after successful treatment for the first attack of diverticulitis, 1/3 of patients will remain asymptomatic. 1/3 will have episodic cramps without diverticulitis, and 1/3 will go on to have a second attack of diverticulitis. The prognosis tends to remain similar following a second attack of diverticulitis. Only 10% of people remain symptom-free after a second attack. Subsequent attacks tend to be a similar severity, not increasing in severity as previously believed. So that's good that the pain doesn't continue to worsen and worsen and worsen until it gets unbearable. All right, and here is my slide with all of the references listed that helped me with research and providing you all information over diverticulitis. I hope that everyone enjoyed my presentation. Have a good day.